There's simply not enough child and adolescent psychiatrists to meet this unmet demand. And Project Teach really supports pediatricians and other primary care health providers to care for children, adolescents, and their families who otherwise wouldn't seek services. We hear from our colleagues across the state that participating together in this program is one of the most gratifying professional experiences they have because the work is so meaningful.
Hello, I'm Rob Hoyle, and welcome to 20-Minute Health Talk. While we associate mental health care with psychologists and psychiatrists, primary care doctors are often the first point of contact for children and families who experience mild to moderate behavioral health issues in the U.S. To strengthen and support their ability to deliver that care, a statewide program called Project Teach provides free psychiatric consultation, support, and training. TEACH stands for Training and Education for the Advancement of Children's Health. And since its inception in 2010, nearly half of the 9,000 primary care physicians in New York State have signed up, leading to over 23,000 consultations of pediatric patients, a critical resource amidst an ongoing maternal and child mental health crisis in the U.S. Our guests today helped to found and now lead this unique program, which is a collaboration between the New York State Office of Mental Health and 7 top universities and hospitals across the state, led by University at Buffalo. Dr. David Kaye is Professor of Psychiatry and Vice Chair of Academic Affairs at the University of Buffalo and the Executive Director for Project Teach. Dr. Kaye, welcome to the show.
Thanks for having me.
Dr. Kaye, you know our next guest very well, another co-founder of Project Teach. Dr. Victor Fenari is Vice Chair and the Director of the Division of Child and Adolescent Psychiatry at Northwell Health and the Site Medical Director of Project Teach. Dr. Fenari, thanks for being here.
Thanks for having me.
Finally, we have Dr. Christina Deligianidis. She is the Director of Women's Behavioral Health at Zucker-Hill State Hospital, a part of Northwell Health, and the new Medical Director of Reproductive Psychiatry for Project Teach. Reproductive psychiatry is actually a new branch of the program created through a recent 5-year, $16.8 million grant from New York State, which expands Project Teach's behavioral health services to now also support OBGYNs, family physicians, and other clinicians who work with women who are pregnant or have recently given birth. As a statewide lead, Dr. Deligianidis will oversee the effort to combat maternal depression and other prenatal mental health disorders using Project Teach's uniquely collaborative approach. Dr. Deligianidis, thanks for being here.
It's my pleasure.
The number of Americans who could benefit from access to mental health care is staggering, and there aren't enough providers to meet the demand. Dr. Deligianidis, among women who are pregnant who have recently given birth, how many are in need?
Yeah, the number is quite large. So approximately 80% of all women who give birth have some, time-limited transient symptoms, changes in their mood, their sleep, obviously. They can experience periods of feeling overwhelmed. But these don't impair their functioning, and they don't require clinical treatment. So for most women, they're able to transition after the delivery, and within 2 weeks, they feel like themselves again. But for 1 in 4 women, they are diagnosed with a perinatal psychiatric disorder. And so that's 25% of all women who are pregnant or postpartum. And we know a subset of these women with severe psychiatric illness can have suicidal ideation or other complications. And in New York State, 1 in 8 women with a pregnancy-related death is due to suicide in the first postpartum year. And, 100% of those deaths are preventable. So in this new state-funded program from the Office of Mental Health, the Project Teach Maternal Mental Health Initiative, we really seek to be able to reduce maternal psychiatric morbidity and mortality in our state and in our patients. So
yeah, sometimes just having that conversation is so important.
Absolutely.
Dr. Fenari, the pandemic has had a huge impact on emotional health in general. How has it impacted our youth when it comes to behavioral health?
Well, currently we're in the midst of a national child mental health crisis. Prior to the pandemic, 1 in 5 youth already met criteria for at least one psychiatric disorder prior to the age of 18. And for many of those disorders, the pandemic has really almost doubled the prevalence of anxiety and depression. And so we're really struggling because our youth are really in crisis.
Yeah, and I guess empowering doctors and primary care physicians through Project Teach is making a huge impact.
Well, there's simply not enough child and adolescent psychiatrists to meet this unmet demand. And Project Teach really supports pediatricians and other primary care health providers to care for children, adolescents, and their families who have mild to moderate mental health problems who otherwise wouldn't seek services. We hear from our colleagues across the state that this participating together in this program is one of the most gratifying professional experiences they have because the work is so meaningful.
Dr. K, tell us about Project Teach and this very unique approach to equipping primary care doctors to help manage minor mental health issues.
So, New York State Office of Mental Health initiated the Project Teach in 2010. We are a consortium of 7 academic centers across the state of New York, and we provide all the services for the program. We think of the program as a 3-legged stool, and our 7 groups work together to offer these services. The first, number 1, is real-time phone consultation. We have a toll-free number that healthcare professionals, physicians can pick up the phone, call us, and they can speak with an expert child psychiatrist or reproductive psychiatrist immediately or within 30 minutes or at their convenience. So they have real-time phone consultation support. Number 2, help with linkage and referral for their patients. And number 3, formal CME education. All of our consortium psychiatrists and program personnel work together on this to have one consistent program across the entire state.
Dr. K, can you give us an example of when a pediatrician might use Project Teach?
So what we do is we will talk with a child's pediatrician, for example, and the pediatrician will call us and say, "Oh, I've got this child. I got a call today. This child is on X medicine. They're not eating anymore. What should I do? What can I do to help with this issue?" So we get calls about medications, about therapy, about other community resources. So we help the pediatricians, the family docs, the obstetricians, psychiatrists can call us. So in essence, we're teaching them to fish.
To hear more firsthand experiences using Project Teach, check back for Sandra's full interview with Dr. Montgomery, as well as Dr. David Fagan, Vice Chairman of Pediatric Ambulatory Administration at Cohen Children's Medical Center. Dr. Fenari, tell us how a typical consult may go.
Well, we would receive a telephone call on our one line that people would see on our website, and it would go to someone who would take the information, our liaison coordinator, and depending upon the request, then the call would be channeled either to a child psychiatrist who was then covering the phone or to the perinatal psychiatrist, and they would take the call in real time if available, but certainly call back within 30 minutes if they were tied up on another call. And the liaison coordinator would have taken some preliminary information, so we had a general idea of the age, the grade, and other clinical aspects of the child, but no name, because really this is for education, not clinical care. So that we didn't establish a doctor-patient relationship, but rather would talk hypothetically about how one would proceed with a child of this age with the nature of the concern. And then we would discuss the case with the primary care physician, make some recommendations, oftentimes asking them to get some rating scales or to obtain additional history. Many of the calls might include follow-up telephone calls several weeks or a month later. And after each call, we ask whether or not we accomplished what they wanted, if they were satisfied. And really from the primary care feedback response, the satisfaction was very high.
It's awesome. That's great. Dr. Fenari, how unique is this nationally?
Approximately 30 states around the United States have some theme and variation of a collaborative care program. However, the one in New York State is the most robust to provide education for primary care. And we know from the hits on our website that there are people in 40 states.